Okay, in this one we're going to start going through the 206 bones in the human body. Or I guess the 206 named bones, because like we said before, there were some like the suture bones and some sesamoid bones that aren't named. So we're just going to go through the ones that are named. And we're going to start with the axial skeleton, so everything here in yellow. And we're going to start at the top with the skull. So the skull major job is to protect that soft squishy brain, but it also has the openings for your pie hole and your air hole. So it's the openings for the digestive system and your respiratory system. It has 22 bones. A lot of these bones are paired bones, and so you only need to know one to know the other. So out of that 206, that number is actually a lot less. Of these 22 bones, 8 of them are found in the cranium. The cranium is going to be the part of the skull that holds the brain. And then 14 of them are found in the facial region. The facial region is the part that is your face. So, looking at the skull here, you can see your cranial bones back here, your facial bones in the front. When you look at the cranium, you can see these divisions between the bones. These divisions are called sutures. They are immovable joints of the skull. They are parts that aren't going to move, because if your job is to protect that soft squishy thing inside, you don't want these wiggling about. The first suture we're going to talk about is the lambdoidal suture. Lambdoidal suture is between the occipital bone and your parietal bones. Then you have your sagittal suture, which is going to be between the two parietal bones. Your coronal suture, if you remember, we talked about a frontal section separating the anterior from the posterior, sometimes called a coronal section. Your coronal suture is between your frontal bone and the parietal bone. And then lastly, the squamosal is between the temporal bone and the parietal bone and intersects with the lambdoidal suture. So, looking back here at your occipital bone and your parietal bones, you can see the sagittal between the two parietals, the lambdoidal reaching around here, around the occipital and the parietal, and then the squamosal right here between the parietal and the temporal bones. At a different angle, again, lambdoidal, sagittal. Here you can see the frontal suture, or the coronal suture separating the frontal bone from the parietal bones. Looking from the side, again, coronal, the squamous is right here, and then the lambdoidal back there. So those are the sutures of the bone. One way I think that helps is if you palpate or touch these different bones as we talk about them, and that way it kind of gets some of that kinesthetic learning going on. So the first bone we're going to talk about is the frontal bone. This is your forehead. It also forms the roof of your orbits. So here you can see the top of those eye sockets. It contains a supraorbital foramen. Cool thing about anatomy and how stuff is named is if you learn the vocabulary, it basically tells you where it is. So supra means superior, orbital is talking about the orbit, and foramen is a tiny hole. And so it is a tiny hole found above the orbit. I think it's really neat. You also have your frontal sinus. That is going to be these air-filled cavities inside the frontal bone. So sometimes if you get sinus pressure, you can feel it right above your eyes, and those would be your frontal sinuses. The next bone we're going to is the parietal bones. You have two of these, a left and a right, and they make the top part of your head. and a little bit of the sides. So the superior and lateral surface of the cranium. Very simple bone, not much to know on this, except that it is the parietal bone. And I'm not going to show it to you outside of the skull. It will only be on a skull picture. If I would ask you what that bone was, it would be in situ on a skull. The next bone is the occipital bone. This is the back of the skull and also the base of the cranium. So it is the back part and the inferior part of your cranium. It has a big hole in it. This is the foramen magnum. Foramen, it's a hole. Magnum, it's big. It tells you what it is. It is a big hole. And this is where the spinal cord starts. So it comes right out through there. You also have occipital condyles. We talked about condyles before. And condyles are going to be these smooth areas where two bones come together. And so where your first cervical vertebrae connects with the occipital bone, it does it at these condyles. And then you have your external occipital protuberance. If you reach up the back of your neck and go to the skull, you will feel a little point. That is your external occipital protuberance. It's an attachment for these nuchal muscles and ligaments that then go down to your back. So looking here, I think this stylized picture is a little bit easier to see stuff. So here you can see that external occipital protuberance, your big hole, your foramen magnum, also your occipital condyles. The next bone we're going to talk about is the temporal bones. So these form the sides of the cranium. They are the bones around your ears. It has a zygomatic process. So if you feel right in front of your ear, you might be able to feel a bit of your cheekbone. If you follow that out, you will definitely end up at your cheeks. There's a process starting back there, just right below your temple, that has the zygomatic process of the temporal bone. You also have your external auditory or acoustic meatus, right here, your ear hole. You have a mastoid process. If you reach behind your ear, you'll feel this rough area that is kind of bumpy. And if you wiggle your neck side to side, like tilting towards your ears, you probably feel a muscle there. That's your sternocleidomastoid that attaches to that mastoid process. It's that big muscle that kind of runs from the back of your head down to your collarbone. The next one is the styloid process. If you look right here, you can kind of see it. It's a very pointy thing. Kind of looks like a stylus, right? So something that you would write like on a laptop with. Styloid, stylus, they kind of share that name. It's important for muscle attachments for the tongue and the pharynx. The pharynx is that muscly tube that your nose and mouth lead into before it turns into your trachea and esophagus. So looking back here, in pink purplish, this is your temporal bone. You can see the styloid process right there, the mastoid process right there. Here you can see the zygomatic process on the temporal bone forming the zygomatic arch, meeting up with the zygomatic bone. So the temporal bone has a lot of stuff on it. The next bone we're going to talk about is this one right here, this kind of purplish blue that runs all the way across. This bone is called your sphenoid bone, and it forms part of the floor of the cranium, also parts of the eye sockets, and it helps to strengthen the side of the skull. A cool thing that it has in there is called the sella turcica. If you look, there's just kind of like this little pocket that houses the pituitary gland. The pituitary gland is super duper important on releasing different hormones that help to control your body's metabolism and growth and development. The sphenoid has two wings. If you look at it in one view, I think that kind of looks like a bat, and this one it kind of looks like a moth or a butterfly. So it has two wings. So we have a greater wing, which is this big one right here, and you can see the lesser wing, which is just this little one in front of it. It's a lot easier to see that lesser wing from an anterior view. So here you can see the lesser and the greater. The next bone is your ethmoid bone. The ethmoid bone forms your nasal septum. So it separates your left and right nasal areas from each other. It also forms part of the inner wall of the orbital. Lots of these bones form the walls of the orbital. The orbital has a lot of stuff going on around it. It contains the cribriform and the perpendicular plate. If you look right here, this is the cribriform. This is an area that the brain is going to rest on. And then you have your perpendicular plate here, which makes part of that nasal septum. Up here at the top, there's kind of a little point called the crista galli. If you've ever seen like self-defense videos and stuff where they take the palm of their hand and strike somebody in the nose at an upward angle, the goal is to dislodge this ethmoid and stick that crista galli right into somebody's frontal lobe, giving them a nice quick lobotomy. The ethmoid also has your superior and middle nasal concha. So if you look here, superior concha and the middle concha. And what these concha are kind of like scroll bones, and they help to slow the air as you breathe in through your nose, and it warms it up and humidifies it. And also you have a bunch of hairs and mucus up there that helps to clean the air. And then as you breathe out, it kind of does the reverse. And so it helps to keep the air nice and clean that you're breathing through your nose. Okay, so that's it for the cranial bones. There were 8 of them. Can you remember them? Frontal, parietal, occipital, temporal, sphenoid, ethmoid. Which one of those had the sella turca? That's the sphenoid. Which one had the frontal sinus? That's going to be the frontal bone. And which one had the crista galli is the ethmoid. Okay, the next ones we're going to talk about are going to be your facial bones. So, the first facial bone we want to talk about is the maxilla. This is the largest facial bone you have. It forms the bottom parts of the orbit. It also forms part of the nasal cavity, and it has the sockets for your teeth, or the alveoli for your teeth. Here you can see the alveolar processes right here. It has a big sinus, your maxillary sinus. Sometimes if you've had sinus pressure and you're like, man, my teeth hurt, that's because of this maxillary sinus. There's your teeth. It can trigger those nerves and cause pain. Something that happens pretty often is people get the maxilla confused with the mandible because they both have teeth, they're both used for chewing, they both start with M. A good way to remember that the maxilla is the top one is that Max has a mustache. So where the maxilla is where a mustache would be. The next bones we're going to talk about are the bones that form part of the hard palate. So some of that hard palate, you can look right here, is formed by the maxilla, and the rest of it is formed by these palatine bones. There's these little L-shaped bones that form part of the roof of the mouth, a little bit of the nasal cavity. You can see the crest right there where they meet up medially. Then we get to our zygomatic bone. This is the bone that gives you the prominence of your cheek. So when people talk about their cheekbones, you're talking about your zygomatic bone. It has a temporal process. If you remember, the temporal bone had a zygomatic process. Well, the zygomatic has a temporal process that meets up to form the zygomatic arch with the temporal bone. It also contributes to the wall of the orbit. Seems like everybody does. If we're looking at the orbit here, you can see you have your zygomatic, you have your frontal, you have your maxilla, you have your sphenoid back here, you have your ethmoid right here, you have another one right here called the lacrimal. Lots of these form parts of the orbit. Talking about the lacrimal right here, it's just a really small, thin bone located on the medial wall of the orbit. Do you know what the glands are called that make your tears? They are lacrimal glands, and they are typically found up here, and your tears wash down and out via this lacrimal duct, which lies inside this lacrimal sulcus. So this groove in the lacrimal has a duct that lies in it that helps to drain your tears away, and it drains them down into the nasal area. So if you wondered why you get a runny nose when you cry, you're actually not snotting snot, you're snotting tears, which is just kind of neat side information. You also have your nasal bones. You can see a bit of it right here, this purple bone that forms the bridge of your nose. If you go out to the tip of your nose, it's pretty wiggly. But as you go up, you actually get to real bone, and it is quite hard. That is how you can break your nose, is you're going to break those bones, those nasal bones. The next bone we're talking about is the vomer. Sometimes they call this the plowshare bone because it looks like a plow. It joins the ethmoid to form the part of the nasal septum. Something else that you can see here are all three nasal conchae, superior, inferior, and middle. You can also see that the sphenoid has a sinus. The ethmoid also has a sinus. So you have a frontal sinus, an ethmoid sinus, a sphenoid sinus, and a maxillary sinus. Lots of sinuses, but they're all named for the bone they're found in. So if I ask you a question like, where can you find the sphenoidal sinus? You will tell me the sphenoid bone. But here you can see the vomer just tucked in there. I really like this image, one, because it's kind of creepy, and two, it's showing you a nice frontal or coronal section. Here you can see where it says coronal. You can see a little bit of the cranial cavity here. As you go down, you can see that perpendicular plate of the ethmoid and those three scroll-like conchae. And right down here, you can see where the vomer meets up with that perpendicular plate. You can also see his big air gaps. These are your maxillary sinuses. They're really big, so when they get inflamed, they hurt a lot. Here you can see it all again in a drawing with your vomer right there forming part of that nasal septum. Very cool. Alright, on to the mandible. The mandible is going to be your lower jaw. It's going to have sockets for your bottom teeth. You also have this mandibular condyle. A condyle is what again? It's where two bones come together and they're nice and smooth. And this mandibular condyle meets up with the temporal bone to form the temporal mandibular joint, or your jaw joint. It also has a coronoid process for muscle attachments. So if you look right here, you can see this big process. This is all for muscles to attach to. There's also some attachments in here. You can see this mylohyoid line, which is where the mylohyoid attaches to the mandible. So lots of places for muscle attachments because chewing is really important. Your TMJ, your temporal mandibular joint, is the only joint that moves in your head, or that's supposed to move in your head. Alright, so which facial bone has the temporal process? That's going to be the zygomatic. Which bone has the sockets for the upper teeth? Remember, Max has a mustache. In which bone is these little L-shaped ones that form part of the hard palate? Those are your palatine or palatine bones. Next up is baby skulls. The infantile skull. If you know anything about children, you know they have soft spots. These soft spots are called fontanelles. They're fibrous connective tissue. And the soft spots aren't supposed to close until about 5 years old. This helps your developing child get a bigger brain as they grow up before the skull hardens and fuses. The head grows disproportionately fast, so if you look at toddlers, you can see they have really big heads, and when they run, they kind of lead with that head. So, if the brain is so important, like we really want to protect it, why would babies have soft spots? One is for growth. The other is to make birthing easier. It's hard enough as is. Could you imagine if the child came out with a fully formed, tight, compact skull that couldn't squish? Something that you could see, especially if you do anything in labor and delivery, is children that stay in the birth canal for a long time come out with these little cone-shaped heads because that skull is pliable. It can move. It makes the birthing process a little bit easier. And so when you look at an infantile skull, it looks kind of like an alien. Here's your frontal bone, your parietal bone. You can see they're not fully fused yet. Here's your anterior fontanelle. This is typically the one that the doctor feels for to make sure it's not closing too soon. And that's about all I want you to know about infantile skulls. The next thing is the vertebral column. You have 24 vertebrae, including a sacrum and a coccyx. It goes from your skull all the way down to your pelvis, helps to support your head, your neck, and basically everything above your pelvis. It also protects the spinal cord and maintains your posture with your spinal curvatures. When you look at a vertebrae, they all kind of have a similar structure, give or take. Pretty much all your vertebrae have a vertebral body. This is going to be the weight-bearing portion. As you move down the spinal column, these vertebral bodies get bigger, so they start out small. Actually, they start out non-existent, and then they get a little bit bigger as you move down. You will see transverse processes, so coming off here to the edges. Transverse, again, running horizontal. And a spinous process that comes straight out the back. This is the part of the spine that you can feel, is these spinous processes. And then you have your vertebral cavity, or vertebral foramen, where the spinal cord runs down through. And you have these articular facets for how your vertebrae lock together. Each of these is separated by an intervertebral disc, which is mostly fibroconnective tissue, and it helps to just cushion that because bone on bone really hurts. And so you can see here how those inferior and superior articular facets meet up. It's kind of like if you take one hand palm up, one hand palm down, and then straighten out your fingers, and they kind of just hook together like the pads of your fingers. So we have 3 vertebral regions that we talk about. You have your cervical, your thoracic, and your lumbar. And when we're naming these different vertebrae, we name them based on where they are in that order. So starting at the top, your first cervical vertebrae would be called C1. Then you have C2. Then you have C3. All the way down to L5. So this guy right here, this would be T7. To remember how many vertebrae are in each group, I like to use this idea of breakfast, lunch, and dinner. You have breakfast at 7, so you have 7 cervical vertebrae. Lunch at 12. Dinner at 5. I know a lot of y'all probably don't eat dinner at 5, but I'm old. So, dinner at 5. So 7, 12, and 5. How can you tell a cervical vertebrae apart from a thoracic or a lumbar? Well, one, they're really small. They only support the weight of the head. Another dead giveaway is that they have transverse foramen. So they have holes in the transverse process. This is for the vertebral artery and vein to go up to the skull with, or up to the brain, going through these transverse processes. So if you see a bone, even one as weird as this is from an extinct bison, you can see it has 2 holes on either side. This is a really large bone. If you look down here, you can see it. That is 14 inches. That's big. That is longer than your forearm. Big. But you can tell it's the cervical because it has 1, 2, 3 holes. So your spinal hole for the spine, and then your transverse foramen. A lot of your cervical vertebrae are going to be bifid or bifurcated, which means they're going to have 2 points instead of just 1 point. So that's another giveaway that you're looking at a cervical vertebrae. Our first 2 cervical vertebrae are really important and look really different, and so we give them very specific names. Your first cervical vertebrae is C1, aka Atlas. If you know anything about Greek mythology or whatever, Atlas is the titan that is forced to hold up the world. Your Atlas is also forced to hold up your world. Without it, you don't have a head. Without a head, you don't exist. So C1 is Atlas. If you look at it right here, it does not have a body. I mean, it is mythical, right? So it shouldn't have a body. So it doesn't have a body, and it articulates with the occipital condyles right here. C2 is the axis. If you look at it, it has this little piece that stands up, and it fits inside of C1. C2, this little piece is called the dens. Sometimes it's called the odontoid process. Odontoid refers to teeth, like orthodontics. And if you look at it, it does kind of look like a tooth. And this is the pivot point for the skull, so they can rotate and say, I don't know what you're talking about. Coming down to our 12 thoracic. These are bigger than your cervical. If you look at the body, it's kind of heart-shaped. Another dead giveaway is that it has this really long spinous process and articulations for the ribs. You have 12 thoracic vertebrae. How many ribs do you think you're going to have? 12 pair. It is a thoracic vertebrae because it hooks up with the rib. Okay? Another thing, I think that kind of looks like a giraffe. So you might think about it as a giraffic vertebrae, not just a thoracic vertebrae. And our last vertebrae is the lumbar vertebrae. It's going to be the largest. It has a huge body. It's really thick. The spinous process on it, though, is really truncated and thick. This is for those lumbar muscle support to help support your trunk. And for me, I think it kind of looks like a moose, like a lumbering moose. So lumbar, lumbering moose, looks kind of like a moose. And then we go down to the sacrum. The sacrum is actually a fusion of 5 vertebrae. And you can almost kind of see where you have 1, 2, 3, 4, and then the 5th one right there. And then you have the holes in between. This attaches the axial skeleton to the pelvic girdle. So you have your hip bones on either side kind of sitting at V's, and then this slides into place in between the 2 of them. It acts kind of like a keystone to hold that entire group together. And then you have your tailbone, which is a fusion of 3 to 4, depends. There's some variation in that. And that's attachment for your anal sphincter. So that's the spinal column. And we're going to finish up real quick with the thoracic cage. So this is going to include your thoracic vertebrae, because that's what the ribs come off of. Your ribs, all 24 of them. and then the sternum right here. Why do you have a thoracic cage? Well, you really want to protect that thing that sits right about there. You want to protect the heart. You want to protect your lungs and the thymus. It's also an attachment for respiratory muscles. You have muscles in between these ribs. You have intercostal muscles. You also have the diaphragm that stretches at the bottom. And then it also helps to support the pectoral girdle and the arms. So behind here you'll have your scapula. Here you can see your clavicle where that pectoral girdle hooks up. So we have 12 pair, one for each or two for each thoracic vertebrae. Our first group are called true ribs. So if you look at the first 7, you'll see they have an individual costal cartilage attachment to the sternum. So they all have their own connection. We look down here to these 3. These are your false ribs. They fuse first and then they go up. So they don't have their own costal cartilage connection. They share one and then connect. So these are false ribs. If you look really close, you can see there's also 2 that don't have any costal cartilage connection. These are your floating ribs. And they're way down here because you want to protect your kidneys. So you have 7 pair of true, 3 pair of false, and 2 pair of floating ribs. When we look at the sternum, we can break down into a couple different groups or areas. You have this part up here with this jugular notch. It kind of looks like the knot on a tie, if you can tie like a double Windsor. This is the manubrium at the very top. It hooks up with the clavicle and the first pair of ribs. So you can see the clavicles coming here to the top, the first pair of ribs coming over here to the side. As you go down, this is the body, sometimes called the gladius. If you know what gladiators fight with, if you ever watched the show with Russell Crowe, they had these short swords. That is called a gladius for the gladiators. And this kind of looks like a short sword. So the body of the sternum is called the gladius. And this has a lot of that costal cartilage connection for the rest of the ribs. And then finally, you have this little bitty thing at the very bottom. This is your xiphoid process, and its attachment for the diaphragm and your rectus abdominis. Your rectus abdominis is that muscle that gives you the six-pack, and it runs from that xiphoid process all the way down to your pubic bones. It's a really long muscle. This is the part of the body when you're doing CPR you do not want to push on. You want to go 2 fingers below that, right? Because if you push it off, do you know what's right here? That's your heart. And that would be a bad thing to break a bone into, especially when you're trying to save somebody's life. So, quick overview on the sternum, manubrium, body, xiphoid, on the ribs, 1 through 7 true, 8, 9, 10, 11 false, 8, 9, 10 false, 11, 12 floating. Which also kind of fit into this false because they don't have their own costal cartilage attachment. They don't have any costal cartilage attachment. And with that, we are done with the axial skeleton. We'll pick up next time with the appendicular skeleton.